When last did the Struisbult Care Centre receive a fire check?
I think what we have done as the department, whenever, almost on a quarterly basis, we conduct these kinds of, what you call safety audits. And it would seem that unfortunately, whilst, the department was still planning to go here in terms of its plan, this tragic, incident occurred. Some of the things that we check when we go to this, centers, we ensure that there is enough, equipment, for dealing with any emergency. We ensure that there are, enough number of people on duty, and we also have to ensure that these people are adequately trained and they can efficiently use the equipment.
Okay, we'll talk about the efficient use of that equipment, but I just really want to get to the bottom of when was the last time it had received a safety check?
Yeah, the safety check, I may not be able to appropriately comment as it is done by our inspectors that come from the municipalities. Like Ekurhuleni, they will be the one that, working with the social workers, do these kinds of things. But like we've indicated, that the plan was definitely underway to make sure that they visit this particular center.
Okay, because a lot of questions are being raised about the fact that yes, now in the aftermath of this fire, we're hearing, statements from officials that yes, a safety check was going to be carried out. It's important to see whether it had been a regular process or whether this wasn't something that was just said in the wake of what's happened.
Yeah, it is true that, like I've indicated, that the safety check, obviously, the institution is owned by a non-governmental organization that we subsidize. And even when we arrived there yesterday, of course, the safety check, we may not say, like I've indicated, when last was done, but at least when we arrived there, we realized that, some of the equipment was not adequately working, and even some of the things that they tried to use, the equipment that they were using, that they were, that everything was kind of finished, that was used on the particular day.
Yeah.
And
you spoke about training right at the very beginning, making sure that part of your department's responsibilities and making sure there's adequate staff and they're adequately trained in the event of a crisis. What we do know from our reporters, a reporter on the scene, is that the fire broke out. Staff at the Struisbult Care Centre tried to stop the fire themselves. For 40 minutes, they tried to keep the flames at bay. And then after did they call emergency services. We spoke to emergency services yesterday and they confirmed this fact and said that had they been called earlier, perhaps a disaster of this scale could have been averted. Clearly it seemed like the staff were not adequately trained to be able to distinguish between what would be something that was manageable and what was something that was way outside of beyond their depth.
Yeah, it actually became quite clear yesterday, after we have done our preliminary report, that there were problems at this particular center. But what we are trying to do at the moment as the department, like we've already, removed the staff. We have removed everyone, all the residents have been removed to alternative places of care. And also what we have done, we are cutting, the subsidy that we grant to this particular, institution.
Is that the key, to take away the money? The point is you still have staff who perhaps needed more resources in terms of being able to carry out their functions correctly. It didn't look like a very well taken care of facility.
Yes, but in terms of the staff that they need, you see, we have moved the residents to different places. And also what we are doing, the staff that used to work there is being deployed, is being taken to those areas where we have taken, the resident to. Dr.
Mokoena, the problem is, we had the fire in Nigel last year, and a lot of the residents there were moved out after 22 people were killed. And some of our reports say some of them were actually moved here to the Struisbult Centre. You have another fire. People are moved again. What is the long-term game plan, Dr. Mokoena, in making sure that A, these centres are properly subsidised, B, that staff are properly trained, and C, that they are well run?
I think that the plan that we have at the moment, we're increasing our subsidies, that we grant to these NGOs. And also we are, like I've indicated, that in collaboration with the Ekurhuleni Metro, we do have a plan that is essentially, aimed at ensuring that we monitor these particular centers from time to time. And we are also committing to, adhering to all norms and standards by ensuring that all the time there should be enough, staff on duty, both night and daytime. And then we're also going to be really taking serious drastic measures, such as cutting the subsidies and also, being very strict in terms of providing the NPO number, the license to operate these kinds of facilities.
Dr. Mokoena, bearing in mind the fire last year, the fire this weekend, would you say that your department and departments around the country are taking the welfare of old and frail people seriously?
Yeah, we definitely are. If you look at the money we spend, the kind of programs we have, we are dreadfully sorry that this particular incident happened. And we also agreed that maybe it could have been avoided had we been able to do the necessary, inspection, on time.
Okay. We'll leave it there. So thank you very much for your time this morning. We appreciate it. Gauteng Health and Social Development spokesperson, Dr. Sello Mokoena.